Why are intraepithelial lymphocytes important in gluten biopsies? Have you ever wondered what intraepithelial lymphocytes are and why they matter in gluten biopsies? These specialized white blood cells are found in the lining of the small intestine. They play a vital role in the immune response, especially when it comes to gluten-related conditions. When diagnosing celiac disease, the presence of intraepithelial lymphocytes is particularly significant. Normally, these cells exist in a balanced number within the small intestine. However, when there is an increase, it can indicate gluten-related damage. Typically, more than 25 to 40 intraepithelial lymphocytes per 100 epithelial cells is a sign of celiac disease. This increase can happen even before any visible damage to the intestinal villi occurs. Interestingly, in some cases, the elevated count of intraepithelial lymphocytes may be the only abnormal finding in a biopsy. This means that even if the villi appear normal, the presence of these cells can still point to gluten sensitivity or celiac disease. Counting intraepithelial lymphocytes is therefore a critical step in interpreting biopsy results. So, what causes this increase in intraepithelial lymphocytes? When gluten enters the body, it triggers an immune reaction. Gluten-specific immune cells activate intraepithelial lymphocytes, leading them to attack stressed epithelial cells in the intestine. This process contributes to inflammation and can eventually result in villus atrophy, which is the shrinking and flattening of the villi. This damage can lead to malabsorption of nutrients and the symptoms associated with celiac disease. From a practical standpoint, understanding the role of intraepithelial lymphocytes in biopsy results is essential for anyone navigating gluten-free living. A confirmed diagnosis of celiac disease or gluten sensitivity guides the recommendation for a strict gluten-free diet, which is the only effective treatment available. Additionally, the count of intraepithelial lymphocytes can help differentiate celiac disease from other conditions that may mimic its symptoms, such as infections or autoimmune disorders. This distinction is important for proper diagnosis and management. In summary, intraepithelial lymphocytes are important in gluten biopsies because they serve as an early marker of gluten-induced intestinal changes. Their increased presence supports the diagnosis of celiac disease, even when other structural changes are not visible. They also help differentiate celiac disease from other intestinal disorders. Understanding their role can assist individuals in making informed decisions about starting and maintaining a gluten-free diet for effective management.